what the valve is like. The aortic valve that we looked at tonight that had two cusps, a lot of times that valve will get narrowed, and patients get in their 50s or so with a bicuspid valve will start to get it really narrowed. Depending on how narrowed it gets and what the gradient is, we kind of measure across that valve. And again, patient symptoms kind of decides the time for going to surgery. So it really depends a lot on what the valve looks like, how the patient's clinically doing as a timing of surgery. It's very important, though, these days we've gotten much better at doing surgical procedures. We do all these procedures here at Shawnee Mission, and we've gotten good at this over many years. And actually would tell you you're better off to get those surgeries done sooner versus later. You don't want to wait too long and at that point have more complication risk or have potentially a valve that we can't fix at that point because it's caused other problems like the heart not squeezing well because it's struggled for so long. You don't want to get to that point. But again, you don't want to do it if you don't need to do it. So really individualized, I think, based a lot on symptoms a patient has depending on what valve it is and what that valve looks like. We do have some criteria of when you should absolutely get that done.
I think the important thing is we don't want to do it too soon, have surgery, but we don't want to do it too late. So we need to sort of reach the happy medium, and echocardiography and especially TEE in this case, again, is really a helpful tool in order to decide when we need to do heart surgery. I think we're out of time, actually. I've really enjoyed this panel discussion. I was sort of fearing it, but I've enjoyed myself, and I hope the other gentlemen, Dr. Beasley and Joe, you've also enjoyed yourself. And
Yes.
With Jeff, you did a great job. Really appreciate it. And we, again, appreciate very much the patient and the family of the patient who let us do the TEE and show this procedure live tonight. And from all of us at Shawnee Mission Medical Center, we thank you for watching this tonight. And you can send us questions by email and follow through on our website. And we'd be glad to answer any questions at any time. So thank you again, and good night.
Thank you for watching this OR Live webcast presentation from Shawnee Mission Medical Center in Merriam, Kansas. OR Live makes it easy for you to learn more. Just click on the Request Information button on your webcast screen and open the door to informed medical care. OR Live, the vision of improving health.